kind of shifted over to Tibetan Buddhism, found it was more full for me. And so maybe people have found other traditions where that's the case. I'm not sure.
Okay.
Yes, please.
Since you've been trained as a Western MD and also been exposed to a lot of Eastern philosophies and practices, when you're treating a sick patient, do you still use antidepressants, antibiotics, things like that, or do you use more Eastern practice?
Eastern 25 years, thank you. 25 years ago, 28 years ago, there was a call from His Holiness the Dalai Lama in Dharamsala for a Western trained physician to come to Dharamsala to interdigitate different healthcare systems. Not to make them one, but to interdigitate them. Have them available for any one patient. Okay? And I took up that call. I went to Dharamsala because of that. And yes, I use a whole range from both traditions. It depends. The newer studies are showing that MBSR works just as well as SSRIs, newer antidepressant medications. I have both in my armamentarium. This is a bad word in my repertoire. I have both, and sometimes I might use SSRIs, or even combine, so people lesser dose and then less side effects. The libido problems are big with SSRIs. People don't like it. And in general, if people are interested, of course I talk about meditation. I don't push anything on anybody. If they come to me, they see I'm in robes, and so they sometimes ask about meditation. Is there something that can help them? And then we talk about it. So I use meditation a lot when it's appropriate, people want. Positive mental states, so important. How to become more positive, less jealousy, less arrogance, less putting ourselves down, all that stuff. So I deal with that sometimes. And we have lots of good studies now that shows that stuff enhances healing. Reduce the negative, increase the positive, enhances healing. It may not be the only answer, of course, but as an adjunct, it's sometimes very, very important. So I try to blend these things best I can. Do I use antibiotics? I've never used a lot of antibiotics, even when I just went in, I trained here at BCM Street. And David Fainer was our mentor. He was a great, great teacher. And he said to us, often, if you're going to order a test, what are you going to do if it's positive? What are you going to do if it's negative? And if it's the same, why are you ordering it? And the same thing for treatment. So we became rather conservative in that sense of not ordering too much and not prescribing too much. That's what we thought was really necessary and really beneficial. And I still kind of practice that.
Have you found anything that helps cancer patients recover better?
Yeah, cancer patients recover better is the question. Many years ago, some of you probably are aware of this, there were some wonderful studies on women with breast cancer. It's been replicated, and now it's kind of mainstream. And the studies were that all the women got whatever was required for the breast cancer. So either it was surgery or radiation or chemotherapy or a combination. They all got that, okay, depending on their type and stage of breast cancer. One group got additionally TLC, love. Sent out a psychologist regularly, just flooding them with love. Okay? So the group of women that got the love, right, in addition to the regular treatment, you can imagine on life satisfaction questionnaires, it scored higher. You would imagine that. But they also lived longer. Yeah? And so now there's a lot of work being done with meditation, positive mental states, and it's showing in many cases that things like IL-6, cortisol, other markers of either inflammation or the immune system, that the situation is improved by positive mental states and meditation. And more recently, there's some work coming out of Wisconsin, University of Wisconsin. It's small stuff yet. They're now in a much bigger study, but showing that actually genetic expression is positively influenced by meditation. What that means is genes, are often under what we call regulation. They either turn on, they turn off. Turn on means they make protein. Turn off means they don't make protein. And what they're finding in this field is called epigenetics, the regulation of gene expression, making protein or not making protein. What they're finding is things like meditation positively affect this whole process, such that you get protein to beef up, to enhance your immune system, and maybe other systems in the body to improve health. This is a new, very exciting area. We don't have so much information yet, but it looks promising. Yes, please, and then we'll go to this woman behind. Please, here first, and then we'll move the black hat, please.
Are you involved only in research, or how would somebody get somebody like you to be their physician?
I have to clone my body. No, I don't do much research. I'm not involved in research generally. I mostly teach. I've been doing charitable medicine for 25 years. I don't charge anybody one Indian pice. Some of you know what that means. It's an Indian penny, and it's worth so little that you couldn't trade it in for anything. I don't charge anything to anyone. In fact, sometimes when people are poor, I try to help a little bit with medical expenses, medicines, etc. So having said that, most of my time is not practicing medicine. I'm still licensed, and in fact, later this year I have to take my recertification exam for the American Board of Family Medicine to keep up my board certification. But I get called in a lot when people are very sick in the hospital and they're told they need this surgery and this toxic medicine and this kind of radiation, and doctor, I need it. So I go over it with them, pros and cons. What are the benefits and what are the risks? And let them make the decision, and we make this decision together. I often play that role, is what's been happening the last few years. So I don't have an office, so I don't have an office phone number, nor do I have an office email, so it would be hard to sign up for me. I just also don't have the time. Sometimes in some places of the world, some rural Buddhist areas in Russia where I go, they flock and they want to ask me medical stuff. And it's usually very, very sick people, often kids, sometimes who are close to death or are really severely having severe problems. Often people are brought to me like that, and I can't say no, so we try to schedule some time, work with the authorities so that it's okay, because I'm not licensed in those countries. And if we can work it out, then I do see some of those folks. And of course, I can't cure those people, but I work with them and the families on how to try to make their lives a little bit easier, in those situations. Thank you. Yes, and this.
You mentioned that in the research study you were in, that there were effects that were significant with regard to the prefrontal cortex.
Yes.
Did they have any results or information with regard to the anterior cingulate or the amygdala?
Yes, both. Yes, they do, and I'm sorry I can't. It gets real complicated. There's a lot of statistics involved on the anterior cingulate and also on the amygdala. There were changes that were positive in meditators, but I don't have the data right here with me. I can't, give you the details on that. But there were positive changes, yes. Are you doing that kind of research?
No.
So, but you're very well educated. Wonderful, wonderful. And maybe a couple more questions, and then we've got to pack it up because the lights are going off. Yes, please.
I just wanted to find out if there is a way for budding doctors to be part of organization where they can come and do some electives and be exposed to something like this.
Yeah, well, we don't offer electives. We mean
The institute?
the institute, the Altruism in Medicine Institute. We don't offer electives. But we can hook you up. There's a wonderful, it's called Humanities in Medicine program at the University at Hong Kong University in Hong Kong. And there are other pockets. We're beginning to make linkages with those. So keep in touch.
Yes.
I mean, keep together with us here, or you could, keep here, and then we can over time kind of explore that together. I don't have an answer right now.
Okay, thank you so much.
What you're going to cover tomorrow in your all-day workshop?
Okay, the question is, what am I going to cover tomorrow in the all-day workshop? I'll give you an honest answer. I don't know. I'll look can see what the blurb says. We do have a blurb, and I'll look at that tonight, and then I'll kind of go from there. In general, somebody have the blurb with them for tomorrow? Anybody remember? Yeah. Oh, yeah, there are no openings, unfortunately, it's filled up. I'm supposed to tell you that. We're going to do a lot of meditation. So we did one meditation here tonight. We'll do a number of different kinds of meditations. This gentleman's question about meditation. We'll do a number of different kinds of meditations to get sort of a flavor of different types of meditation. And I'll explain more about some of these positive mental states. I'll probably go into anger management, which is a biggie, how to control anger. More than that, I don't know yet. You'll have to ask some of your friends to attend, okay? And I would like to say, no promises, I can't make promises about this. But since there was an overwhelming response tonight, and I feel very badly that a lot of people were turned away, weren't able to, we didn't expect until maybe a couple days ago, people started getting the idea, oh, it looks like a big response. So we weren't able to change the venue. And this is also such an incredibly beautiful place, wonderful. But if we'll try to do this next year, in which time we'll try to get, if there's interest, it looks like there's a lot of interest, try to get a larger venue. Okay? Maybe one last question, then we'll call it a night. Yes, ma'am?
Not about meditation, but you talked about being the same. You talk about being the same on the inside and the outside and not having a difference there. But isn't that part of socialization? And how do you have a society if everything that's inside is on the surface? Doesn't there have to be filters? Isn't that what we socialize people to do?
You want to tell us about your private secret?
But isn't that true? We can't all just go out emoting.
Well, you're right. You're right. We can't just, it doesn't work if we just spill everything the inside and the outside. But the point was not quite that. It's a very good question. The point is to be sincere and genuine. Is not to kind of project an outside persona that's very different from the inside. That's the point. And that's what integrity is all about. And that's what transparency is all about. There may be some opacity in the transparency, but basically it's got integrity, it's got honesty. That's the main point.